As the obesity epidemic continues to spread, more and more Americans are turning to surgery as the way to lose weight. But what if you could reap all the benefits of surgery without having to undergo the knife? Juju has more on this potential power of hypnosis. It's so strong.
That is the question. Could you trick your mind into thinking that you had surgery? Now, hypnosis is so widely acceptable. In fact, an NIH study reports that 2/3 of all doctors say they refer patients for hypnosis when appropriate. But could you actually trick your subconscious into believing you'd had bariatric surgery? For one woman that I met, the proof is in the pounds.
Marianne Zega is on a gurney, about to have gastric band surgery. She smells anesthetic, hears operating room staff, and feels doctors putting a band around her stomach. It's an operation that happens tens of thousands of times a year. But what makes this procedure unique is that none of it is real.
You feel relaxed.
It's all taking place in Marianne's mind. It's called Gastric Mind Band, and it's done through hypnosis. The treatment is the brainchild of hypnotherapists Martin and Marion Sheeran, who run a clinic in Europe. They got the idea a few years ago from a patient.
So my next door neighbour's just been in hospital and paid a lot of money, had a gastric band fitted, and I just thought maybe if I came in to see you, you could hypnotise me to make me think I've had one done. Much cheaper, no surgery. And
a clever patient!
Yeah.
The idea is to fight obesity mentally. The intensive 4-day program also includes behavior therapy to help patients understand what triggers their eating and resist temptation. But it culminates in the gastric band hypnosis session.
We create smells into the room and have background noises, because the more senses that are involved in the whole process, the stronger the suggestion is.
I have to say, it sounds like you're waving a magic wand over someone. Is that what this is?
No, it's far from that. It's got to come from the person themselves. The shrimp are good.
Which brings us back to Marianne. Last year, at 325 pounds, she was ready for a change after struggling with her weight for most of her 47 years.
My weight controlled my life. I was more a homebody. It probably prevented me from dating a lot and just doing everyday things.
You were really this close to trying the surgery.
Yes, I already went to my doctor, consulted with her.
But instead of surgery, she went to see Hazel Newsom, the only hypnotherapist in the U.S. trained by the Sheerans in the Gastric Mind Band.
We've had weight loss hypnosis for quite some time. This is different.
Yes, they absolutely do believe that they have a smaller capacity to eat. Yes.
So in your mind, you have a band around your stomach.
Yes.
And that feels real to you?
Yes. Immediately after I left, I felt different.
How long did it take before the weight started coming off?
It just felt like it melted off of my body overnight.
This is her before, this is her now.
Yesterday was 10 months and I've lost 120 pounds.
How do you explain how that happened?
Through my subconscious, through my mind. My mind controls what goes into my body.
Their European clinic has been so successful, the Sheerans will now offer their $3,000 therapy here in New York.
I'm a journalist, so I'm paid to be skeptical, because $3,000 is an awful lot of money to be paying for what is essentially an unproven treatment.
Type 2 diabetes is also very, very expensive on your health. I don't actually know whether you can compare, if you can put a price on it, what someone's getting.
You have a 6-month waiting list. What explains that, do you think, Marianne?
Because word has spread now, and we've had such a good success rate.
Over the course of the last 4 years, we've treated just over 400 people with this treatment. The success rate has been very, very high, over 74%.
There's been no sort of rigorous scientific study of whether or not your process works yet. And in many ways, it's unproven.
You're dead right. You know, a pure medical paper will probably be the next step for us.
But Marianne has all the proof she needs. She says she doesn't just have a new body, but a new life as well.
How would you describe yourself then versus now?
I'm dating. I go out a lot more. I'm more confident. I feel like I'm living my life now.
So you genuinely feel like a changed woman?
I do.
So uplifting. Now, the head of the American Society of Clinical Hypnosis says it's hard to find a field that hasn't used hypnosis successfully. Everything from quitting smoking to irritable bowel syndrome, and especially for pain management, childbirth, and even for some patients, surgery.
I'm very happy for Marianne. And he talked about the success rate. Is it proven?
It's a very high success rate, but it's their numbers. They're reporting 400 patients, 74%. I said, but it's basically unproven until you get it published and peer-reviewed. And they said, look, we're eager to do that because that's the next step for us. If we can get that kind of scientific documentation, we can offer it more widely. Insurance companies would pay for it, and that's the key.
That is the key. All right, Juju, fascinating to say the least. Thank you.
Welcome to Healthy Life. I'm Dr. Timothy Johnson. The current issue of the Journal of the National Cancer Institute contains a study suggesting that women who spent 15 minutes learning or doing hypnosis before breast surgery had less pain, quicker recovery than the women who didn't. This was in a so-called randomized study. And so we want to talk about the power of hypnosis today. We're fortunate to have as our guest Dr. Woodson Merrill, who is the Executive Director of the Continuum Center for Health and Healing at the Beth Israel Medical Center in New York. He joins us from New York. Welcome, Dr. Merrill.
Nice to be with you.
I've heard dozens of definitions of hypnosis over the years. I'd love to hear how you explain it in the simplest terms.
Hypnosis is a technique that allows the patient to be able to access parts of their mind that they normally don't have access to bypass conscious controls, to use some of our subconscious mind to allow us to achieve results, to better heal, particularly some of our physical problems and processes.
I once heard hypnosis described as a very heightened state of concentration, sort of akin to getting involved in a good book and not realizing what else is going on around you. Is that a good analogy, or is it misleading?
No, it's a very good analogy. You're putting you in a state where you're actually not worrying about your conscious problems. Actually, it's kind of akin to daydreaming in many ways. You're driving down a road for 10 miles, not really realizing where you'd actually gotten to during that period of time. It allows us to have a better focused attention and concentration and absorption of thoughts than we normally would when we're usually acting on more the surface where there's a lot of stress and background noise that disturb our proper thoughts.
And I can understand getting lost, as it were, or focusing and concentrating, but how does that translate into actual physical changes, as in this study where the women report less pain?
It's an incredibly important study, and there actually follows on the heels of literally hundreds of studies that have been published about the effectiveness of hypnosis. Its use in the United States goes back 150 years, and actually next year will be the 50th anniversary of the American Medical Association approving hypnosis as a technique that has value. So its utility has been around for a very long time, but it's a very underutilized technique in medical care.
But again, I would ask, how does this mental state, as it were, that we achieve, translate into actual physiological change?
Well, our most powerful healing tool is our mind, and the ability to control our mind is key to healing. And whatever technique one uses, whether it's meditation or imagery or hypnosis, we have access, and we have tools that we can access to help heal ourselves, and that's the key. The preventive medicine focuses on diet and lifestyle measures, nutrition, but hypnosis is a wonderful tool for getting to a little deeper level with a therapist who can help you access parts of your mind you might not be able to do by yourself.
We've all, we've all seen or heard of so-called stage hypnosis, where people or stage people sort of get people to do things they would never otherwise do, play tricks on them, as it were. What's the difference between that and using it in this context? I mean, I understand the different intent, but is there a difference in process?
Well, not really, but nearly 90% of people are hypnotizable, and there's actually tests that can be done to see how hypnotizable you are. Developed by Herbert Spiegel. You had a little shot of him earlier. There are 4 stages, and the people who are doing the stage hypnosis, the hypnotist is very clever. They actually pick people who are extremely hypnotizable. You can almost drive a railroad train over them and they wouldn't notice it. Most people are in a lower state of hypnotizability, but most people can be hypnotized. Even ones who can't be hypnotized very well are still very open to the power of suggestion for relaxation with their mind.
Now, talk about some of the modern applications of hypnosis in the world of regular medicine besides pre-surgery. I'm sure you and others are using it in different clinical situations.
It's used for compulsive tendencies, even addictions such as smoking and eating, to try to change behavior. It's used for specific physical problems such as gastrointestinal irritable bowel, ulcerative colitis, allergies, asthma, hypertension, relaxation during deliveries for women. arthritis, fibromyalgia. The list is tremendous. There are literally dozens of medical conditions that have been shown to improve with the use of hypnosis and better control of our mind.
We often hear that because it's so safe and simple and generally low cost, why not give it a try? But is there a potential danger with it? Can it be abused by an unscrupulous practitioner?
No, you can't be made to do something you don't want to do. You can't be made to go out and kill someone with hypnosis, unless, of course, you have a deeply pathological personality. But for most people, it's very safe. There's no downside. It's a state of relaxation. One fear that people have is that they'll lose control, and that does not happen during hypnosis. You're actually conscious and awake and alert. You can actually be reading the newspaper while you're being put into a state of heightened awareness and hypnosis.
I assume there are reliable written sources on the Internet, in books that people can turn to?
Yes, there are very many good ones, including Dr. Herbert Spiegel, who really is the godfather of the field. Now, if you don't mind, I'd like to say one thing about this study that I think is important, because this showed not only an improvement in outcomes of pain, anxiety, nausea, and fatigue, and reduction in the use of anesthetic agents. This was done for the most commonly performed surgical procedure in the United States, which are breast biopsies and nodule removal in women. And it showed not only improvement in outcomes in everything they measured, but actually showed an improvement in cost of nearly $1,000 to the hospital. One of the problems in making these techniques more widespread is that even though there may be dozens, or even in this case of hypnosis, hundreds of articles showing better clinical outcomes, there are very few studies that actually show whether it costs more or less, and so insurance companies are often reluctant to utilize them, as are hospitals. This study showed there was a savings of nearly $1,000 on average per patient. You could actually hire a full-time therapist to do hypnotherapy, and after they treated the first 100 patients, essentially the hospital would actually begin to make a profit by having this technique available to patients. So it's actually in the hospital's financial interest to utilize this, and when you begin to combine better outcomes with cost benefits, then you really have agents for change that maybe begin to help transform our healthcare system, to make these techniques that have been around for decades or even hundreds of years available to the patient on a widespread basis, which they need to be. I feel very strongly about that.
Very important point in our cost-conscious age. Very good information, Dr. Merrill. Thanks for taking the time to join us this morning.
Thank you for letting me join you.
Surprising new study about your health care and hypnosis, no less. Claire Shipman brings us a new study in the Journal of the National Cancer Institute, which finds that patients undergoing breast cancer surgery who used hypnosis saw a real difference.
You sort of feel like you've been rolled over by a Mack truck when you wake up.
For Helen Dorman, the pain of breast surgery was almost more than she could bear.
I'd like you to close your eyes and let yourself relax.
This, she's been told, can make a difference. And no, it's not a new drug, it's hypnosis.
I'd like you to focus all your attention on that relaxing feeling in your toes.
In fact, a new study in the Journal of the National Cancer Institute suggests hypnosis might reduce more than just pain for women before and after breast cancer surgery.
We found patients in our hypnosis treatment group had less pain, they had less nausea, they had less fatigue, and they were less emotionally upset or less anxious. And so it really was a big win for the patients.
Hypnosis has a long history of being effective for pain, weight loss, and even cigarette cravings. Amazingly, medical hypnotherapy has even been used in place of traditional anesthesia. During this operation, a doctor completed skin grafting without any other anesthesia. His patient, a frail middle-aged woman, was able to withstand the pain because she was effectively hypnotized.
This was truly amazing. You cannot do this with anesthesia.
Interestingly, the hypnosis patients cut down their costs as well as their pain. Surgical costs were reduced by about $773 per patient, mainly due to the time savings.
Just a cool and relaxing feeling.
But most important for patients like Helen Dorman, hypnosis therapy seems to offer a ray of hope in the ongoing struggle with cancer.
I have a wonderful life, a fabulous family, and I want to be here to become a very old breast cancer survivor.
Now, the obvious question so many people watching this are going to have, would it work with other sorts of cancers, other surgeries? The author of the study will be looking at just that.